Okay, so we're going to make a model of the heart now, and as you can see we've got some Play-Doh, two strips. It's around 6 centimetres long and around 2 centimetres in diameter. Obviously there's a blue one and a red one, and they're going to represent the left and right side of the heart. Okay, so we're going to start off by just moving the blue one out of the way and just focusing on the red tube, which is going to represent the left side of the heart. So first of all, just split it in two, and then the smaller bit, one of them, split that in two as well. Okay, and we'll just pop these two bits out of the way just for the moment. This is going to be our left ventricle, and the left ventricle is of course the very centre of the heart, and it's really the scaffolding around which everything is built. So to model this, basically what you need to do is turn it into a sort of rather squashed looking cone like this, which is roughly the shape of the left ventricle. And when it contracts, it both squeezes up this way and it squeezes in that way. And there's also a torsional degree of contraction as well. So that's the left ventricle. We'll leave that there just for a moment. If you take one of those little bits that you set aside earlier on and turn it into a little ball, that's going to be the left atrium. Now this kind of sticks on the corner here of the left ventricle, okay? And that sits at the back as well. So we're doing it very much from my point of view there, and it's sitting behind and just slightly above the left ventricle. The third blob we've got there, let's just take that and we'll squidge that out, make it quite long like this. This is our aorta, and if you just connect it to the top of the left ventricle, somewhere around there, and then wrap it around the back of the left ventricle, but making sure you leave a little hole in there. So that's the left side of the heart built, and as I say, the right side sort of glued onto the side of it, and with the arch there going around the back of the left ventricle. So let's leave that there just for a moment, and just move it slightly to one side so we can start to look at the right side of the heart. So again, break this in half. Okay, and then the smaller bit, again, break that in half again. So we've got three bits, two little ones and a bigger one. So this is the ventricle. Now, some of you may be thinking, well, actually, surely the ventricles have the same stroke volume as the atria, which is of course true, but the ventricles have of course a lot more muscle, which isn't why in a model like this they look much bigger in terms of the amount of Play-Doh that we're using, whereas the atria are very thin-walled and mostly just a big cavity. So the right ventricle we're going to stick onto the left ventricle. Now, a couple of important things. It kind of sort of wraps around the side of the left ventricle, rather like this, and the tip here is the left ventricle. So it's important that the tip is left as that. Okay, so there it is. There's the right ventricle. Now, the left ventricle's got a fairly sort of in and out route. The right ventricle kind of goes off at right angles. And we're going to try and model that by now putting the right atrium on. So get one of these smaller blobs here, and you've now already turned it into a blob, but just extend it so it's got some sort of ears at the top like this. These are of course going to be the SVC and the IVC, and then stick it on the bottom there. If you're doing it well, it sort of props up the right ventricle. Of course that's not needed in real life because we've got fascia to do that for us. And you can see it's right there next to the left atrium, and that's where we're going to have, if there's an atrial communication, it's going to be right there around the back of the heart. So once we've done that, the last thing we need to do is the pulmonary outflow. And so again, get your Play-Doh and squidge it out like this, so it's quite long. And then roughly halfway down and break it in half, and then stick one of the bits to make a sort of T shape like this. So this is going to be the pulmonary outflow and the beginnings of the two pulmonary arteries left and right. And then what we do is we squeeze that just through there, that little gap there, around the back, and we bring the pulmonary artery over the top of the aorta to join onto the right ventricle down here. Okay, so we can see the blood coming in, then it goes into the right ventricle, and then out this way, and into the two pulmonary arteries there. So now we can begin to see really some of the key features of cardiac anatomy that you've got. So first of all, how the left ventricle is basically the core of the heart, and everything's kind of glued on around it. The left ventricle pumping into it just from above, right behind, and then it comes out and underneath the pulmonary artery here to the aorta, which then twists around the back of the heart. Whereas the right side, the right's kind of glued onto the side of the left, with the filling chamber here coming then at right angles through the right ventricle into the pulmonary arteries. And these pulmonary arteries twisting around the aorta there to go into the lungs. And the right pulmonary artery here, you can see it underneath the underneath the aorta there. And so a few other things you might see on there. Obviously a VSD is going to be somewhere between these two vessels. And you can see a VSD isn't really going from literally the patient's left to the right. It's actually going quite a lot anterior as well. That's one thing to note there. Another thing you might notice, the ductus. Look where the ductus will be. It's right at the back over here. Probably can't see it terribly well until I bring up the heart like this. So the ductus will be right up there, and the blood will be very, very posterior that's moving in that stage. So there we go. That's how to make a heart out of Play-Doh.